8 home remedies to naturally lower your creatinine levels and avoid dialysis. You may be able to lower your creatinine levels and support kidney health by avoiding certain supplements, medications, and other substances, such as cigarettes. Creatinine is a waste product that's generated when you use your muscles. Eating lots of protein may also produce small amounts of this organic compound. If your blood creatinine is high, it's important to work with your healthcare professional to develop a treatment plan to address any medical issues that might be harming your kidney function, along with your medicines and other treatments. Ask your healthcare professional whether the following lifestyle changes are appropriate for you. Why creatinine matters. Your bloodstream transports creatinine to your kidneys, where your body filters it through your urine. However, if your kidneys aren't working properly, the creatinine level in your blood can build up. Your healthcare professional may check your urine and blood for creatinine, as well as order other tests to evaluate the health of your kidneys. A normal level depends on age, race, gender, and body size. Abnormal creatinine levels may be a sign of kidney disease. You may need a creatinine test if you have these symptoms: changes in urination frequency, pain, foaminess, or blood, muscle cramps, fatigue, nausea or vomiting, puffiness around the eyes, swelling in the feet or ankles. Your doctor may likewise recommend regular creatinine testing if you have any of the following conditions, which may contribute to decreased kidney function: diabetes, high blood pressure, thyroid disease, autoimmune diseases, bacterial infection of the kidneys, a blocked urinary tract, a family history of kidney disease. Creatinine levels can also rise temporarily from strenuous exercise or using certain medications like sulfamethoxyl, trimethoprim, or chemotherapy drugs. Furthermore, becoming pregnant or eating a diet high in red meat may contribute. Your body needs to clean your blood to function optimally. The best way to lower your creatinine levels is to treat the underlying cause. Here are 8 ways to naturally lower your creatinine levels. 1. Don't take supplements containing creatine. Creatine is a natural compound made in your liver. It's transported to your muscles where it's used for energy. When creatine is used as energy, it's degraded into creatinine, metabolic byproduct. In addition to its natural form, creatine is available as an oral supplement. Some athletes use these creatinine-producing supplements to help enhance athletic performance. Anyone wishing to reduce their creatinine levels to improve their kidney function should not take creatine supplements. While creatine supplementation has been widely studied, there is a lack of long-term studies on people with kidney disease. 2. Reduce your protein intake. Research shows that eating large amounts of protein can increase creatinine levels. Trusted source, at least temporarily. In particular, cooked red meat can affect creatinine. The heat from cooking causes the creatine found in meat to produce creatinine. People following diets very high in red meat or other protein sources, including dairy products, may have higher creatinine levels than people who eat fewer of those foods. If you eat lots of red meat, switch to more vegetable-based dishes. Try swapping out beef burgers for. 3. Eat more fiber. More research is needed to determine dietary fiber's effects on creatinine levels. Nevertheless, one study showed significant reductions in creatinine levels in people with chronic kidney disease who increased their fiber intake. Fiber can be found in many foods, including fruits, vegetables, whole grains, legumes. 4. Talk with your healthcare professional about how much fluid you should drink. Dehydration can raise creatinine levels. Fluid intake can also be an issue for some people who have kidney disease. Talk with your healthcare professional about how much water and other fluids you should drink daily, as well as the best time to drink them. 5. Lower your salt intake. Diets that include excess salt can contribute to high blood pressure. Processed foods, in particular, are often loaded with sodium and phosphorus. Trusted source, which studies trusted source have shown potentially cause renal issues. Consider focusing on whole, unprocessed foods and using spices and herbs to flavor your food when possible. 6. Avoid overusing NSAIDs. Over-the-counter painkillers like non-steroidal anti-inflammatory drugs NSAIDs may be harmful if taken too often or in amounts over the recommended dosage, especially if you have kidney disease. Talk with your healthcare professional to determine the right treatments for pain and inflammation and how often to take them. 7. Avoid smoking. Smoking cigarettes can harm the body in several ways, including significantly increasing the risk of chronic kidney disease. Quitting can be a way to reduce the likelihood of issues with your kidneys that may increase creatinine levels. 8. Limit your alcohol intake. Alcohol consumption can be a tricky issue when it comes to kidney function. Other studious trusted sources have shown that excessive alcohol has the potential to damage the kidneys. It can also contribute to conditions like high blood pressure and alcohol dependency. If you drink alcohol, consult your healthcare professional about the safest levels for your health needs.